I'm Emily. I'm the Community Health Educator here at Good Shepherd, and we'll be talking about COPD and what it is. November is National COPD Awareness Month, so that is why I chose this topic. It's not going to work. Okay, so COPD is chronic obstructive pulmonary disease. It is irreversible damage to your alveoli. It is known as the air sacs in your lungs. So you have like these little, I call them little balloons, and when you breathe in, they expand. When you exhale, they shrink down. The air sacs enlarge and the membranes will break down with your breathing. So you think about the elastins in your pants. When you snap it, you want your lungs to snap back. When you break down the alveoli, the snapping does not occur, so you get air trapping. Alveoli also fills up with mucus, which is from the chronic bronchitis portion of COPD. There's chronic bronchitis and emphysema. So you have that wall breakdown, and then you have the inflammation and mucus production combined. And it is common with older adults who smoke or have formerly smoked and secondhand smoke. This is an example of a healthy alveoli. You can see all those nice little pockets of air. And then right here, you can see where it breaks down, where you have just one big pocket. And that is where the elastins does not snap back. So you can't get that extra air out, which is called air trapping. And that is where you get an increase of CO2 and decreased oxygen levels. You also have a longer exhalation, which in return, you have a shorter inhalation period. Chronic bronchitis is the second part of COPD, so you'll have that inflammation and irritation of your bronchi, which are the tubes of your airway. You'll have that increased inflammation and mucus production, so people with COPD, they often cough a lot in the mornings to help get that mucus out. The main symptom is a yellow-gray mucus in the morning. So symptoms are chronic cough, mucus production, wheezing, and then difficulty breathing at rest and with exertion. Some people with COPD, when it's end stage, can't even roll over in bed without becoming short of breath and wheezy. To get diagnosed with COPD, you'll go through a pulmonary function test, which is a big box that you sit in and perform breathing exercises. You can be diagnosed with a CT scan. It is less common. They can just see the air pockets getting bigger and bigger and not shrinking, which is how they diagnose with CT. And then you can see it on chest X-ray. It cannot be officially diagnosed unless you've had a CT scan or a PFT, which is a pulmonary function test, because that is the golden standard. This is an example of what a PFT is. So you have the the nose clips on, and then you're going to breathe into a mouthpiece, which is two filters. You'll have nitrogen and oxygen going through these large tubes right here, and then this is your exhalation tube, and it is to see how much air is in your lungs and what you're inhaling and exhaling. This is an example of what a CT looks like. So I'm sure most of you have had a CT scan before. They're not very comfortable. You haven't, you're lucky. It is a big machine. You lay on the bed and they push you in and out. You have to hold your breath, inhale, exhale. Here is an example of a chest X-ray. So what you're going to look for with COPD is the hyperinflation. So on a normal X-ray, you'll see maybe 6 or less ribs. Here you can see up to 10 ribs. And then you'll see that flattened diaphragm right here. It's pretty flat. That is a big sign of COPD. So for treatment for COPD, you'll have your inhaled steroids, which is like a Pulmicort, a budesonide, Q-var, which isn't as common anymore. You'll have your inhalers, your beta-2 agonists that help increase your airway flow, airway size, your mucolytics that will help liquidize your mucus to help you cough it out. Extreme cases or even moderate cases, you'll have oxygen, CPAP, and BiPAP. For an exacerbation, you'll have the oxygen, BiPAP, and everything combined. So for maintenance, there is an action plan, which I will show you a picture after this slide, where it's red, yellow, green. Green, you're good to go, keep doing your daily routine. Yellow, you're kind of aware your symptoms are getting worse, call your doctor. Red, go to the emergency room. You have your inhaled steroids, your rescue inhaler, oxygen if needed, and an emergency kit. So you would have oral steroids along with your inhaled antibiotics and a nebulizer kit. This is an example of what an action plan looks like. So your eating and appetite are normal, activity levels are normal, breathing is normal, cough, mucus. You'll follow all your medication rules. Your yellow days, you have a low-grade fever that doesn't go away. You're needing that rescue inhaler more often. You're more breathless, so walking to your mailbox, you might need to take a few steps, stop, start again. You should be a little concerned, let your doctor know. Start your emergency pack if you need to. And then red, you would have disorientation from the increased oxygen or increased CO2, lower oxygen levels, slurring of your speech, severe shortness of breath, like you can't even stand up and walk, it's so short, you're so short of breath, and then coughing up blood. So you would need to call 911, get to the emergency room right away. So COPD is chronic obstructive pulmonary disease. You have the golden standard to be diagnosed would be a PFT, X-ray, or you can see it on the X-ray. It's everyday maintenance, and then your emergency pack. And then, do you have any questions?